Today, I'm going to be talking about osteoporosis and anorexia nervosa. For this project, my research question was, how can anorexia nervosa lead to osteoporosis? What is anorexia nervosa? Anorexia nervosa is an eating disorder characterized by restriction of food intake leading to low body weight, typically accompanied by intense fear of gaining weight and disturbed perception of body weight and image. The effects of anorexia nervosa include nutritional deficiencies, hormonal imbalances, weakened bones, also known as osteoporosis, gastrointestinal issues, and anemia. What is osteoporosis? Osteoporosis is a bone disease that develops when bone mineral density and bone mass decreases, or when the structure and strength of bone changes. This can lead to a decrease in bone strength that can increase the risk of fractures or broken bones. Some factors that contribute to bone disease include undernutrition, deficiency of insulin-like growth factor 1, amenorrhea, body mass index, low body mass index, calcium deficiency, and excessive exercise. All of these factors are effects caused by anorexia. Deficiency of insulin-like growth factor 1. Anorexia nervosa often leads to a state of malnutrition. This can cause a decrease in the production of IGF-1 because adequate nutritional substrates are necessary for IGF-1 synthesis. Low levels of IGF-1 reduce the levels of osteoclastin, a maker of bone formation, and causes abnormalities in osteoblast function. In adolescents with anorexia, reduced IGF-1 levels can impair growth and bone development, contributing to stunted growth and osteopenia, which leads to osteoporosis. In adults, anorexia-related IGF-1 deficiency can lead to continued bone loss and muscle wasting. Amenorrhea. Amenorrhea is the medical term for the absence of a menstrual period in a female reproductive age. Amenorrhea in patients with anorexia nervosa is caused by hypothalamic suppression of gonadotropin releasing hormone, leading to reduced secretion of the follicle-stimulating hormone and luteinizing hormone, which results in low estrogen state. One of the most significant consequences of low estrogen in patients with anorexia is its impact on bone health. Estrogen is essential for bone growth and maintenance, and its deficiency can lead to osteopenia or osteoporosis. Women with anorexia nervosa are at a particularly high risk for fractures, and this risk is increased by the combination of low body fat, poor nutrition, and reduced estrogen levels. Body mass index. Low BMI often suggests that a person may not be getting enough nutrients essential for bone health, such as calcium and vitamin D. Malnutrition, including low intake of calories, protein, and key vitamins and minerals, can interfere with bone formation and can contribute to bone loss over time. Patients with anorexia nervosa have low BMI. Research shows that lower BMI is correlated with lower bone mineral density, and low BMI in patients is a significant predictor of higher risk of osteoporosis. While doing my research, I looked into it and found case studies and real-life examples of anorexia leading to osteoporosis. So let's take a look. The first case study I did was a human clinical study design. The study aimed to assess differences in skeletal mass between women with anorexia versus a normal control. 18 women referred to the eating disorders unit at MGH, Mass General Hospital, and a control group of 28 women of normal weight and no history of anorexia nervosa were selected for comparison. All patients and controls underwent bone densitometry by direct photon absorptiometry, and 4 to 6 scans were made in different positions. In conclusion, the 18 anorexic women had a significantly lower cortical bone density than the 28 normal controls. In my second case study, it was a randomized control trial, and the study aimed to assess if tetrapartide can increase bone mass density for people with osteoporosis caused by anorexia nervosa. A group of postmenopausal women with anorexia and osteoporosis were given a treatment, and later a randomized control of 21 women were treated with teriparatide or a placebo. In conclusion, they found that the postmenopausal women with anorexia and osteoporosis showed improvement in BMD by 12% at the lumbar spine and 21% at the femoral neck. The control group also showed that BMD at the lumbar spine was increased by 6% within 6 months, even after correcting for baseline body weight. And in the last case study, it was an experimental study, and the goal was to analyze the bones of an Asian otter after being malnourished. In this study, the right epiphyseal bone, the right radio intermediate carpal bone, and the second carpal bone and left fibula were fixed and declassified in commercial declassification solution at room temperature for 4 days. The other bones were treated with 4% sodium decahydrate tetraborate at 90 degrees Celsius for 20 hours and then dried in room air after washing and running water. In conclusion, they found that there was numerous pock marks on the bone surfaces indicating bone mass loss and bone fracture. Based on these findings, the otter was diagnosed with osteoporosis. The main causes of osteoporosis in animals are calcium deficiency due to starvation or malnutrition, showing that anorexia in animals can also lead to osteoporosis. So now that we see how anorexia can cause osteoporosis and weaken the bones, how do we reverse the effects? One of the main treatments is weight restoration. Restoring the weight will help increase BMD and strengthen the bones again, and the best way to do this is through a balanced diet. Physical activity and hormonal therapy can also help. So, in conclusion, anorexia nervosa significantly increases the risk of osteoporosis. The restricted intake of essential nutrients such as calcium, vitamin D, and protein, along with hormonal disruptions like low estrogen and growth hormone levels, significantly impairs bone metabolism and increases the risk of osteoporosis. If you or anyone is struggling with an eating disorder and is looking to get help, please reach out to any of these phone numbers. You are not alone.